Hi, sorry I can't be with you just at this moment. Hopefully I'll be joining later. My name is Jo Taylor. I am the founder of two organisations called After Breast Cancer Diagnosis and MetUp UK. As a patient advocate, I can see the many issues that there are living with this devastating, incurable illness and being ignored and invisible. Secondary breast cancer has to be highlighted. It is the biggest killer of women with cancer under 50. In the UK, 31 women die every day. That equates to around 1,000 a month, 11,500 every year, and there are 80 men who die of secondary breast cancer as well. We want to survive longer. We need improved outcomes for secondary breast cancer patients. There is a total lack of awareness of secondary breast cancer as it is ignored, and there is no awareness campaign about the disease like there is for primary breast cancer. GPs don't understand secondary breast cancer, and patients with primary disease can be ignored due to a lack of understanding. I created an infographic to show where patients will develop secondary breast cancer, and the NHS in England is now signposting to this important document. Pfizer have supported this document to be translated into 11 languages, so there will be awareness worldwide. There needs to be an uptake of the infographic and for it to be used within the whole of the UK. There is an end of treatment summary report that was created in Greater Manchester Cancer that includes the infographic, which is shared within NHS England, supporting awareness for patients. The document is also shared with the GP via Gateway C, which is a portal for GP learning. Again, GPs need to be aware of what to look for patients instead of sending people away, especially if those have already had primary breast cancer. In England, there are many things that need to be improved. This is around awareness for secondary breast cancer. Women just don't know these red flag symptoms, as many patients have shared their experience with me. We need speedy access to effective drugs. We need to be counted, and data needs to be collected, as there are no figures for those who are living with secondary breast cancer, as highlighted recently in a BBC report. We don't have true personalised care. Not everyone has access to specific radiotherapies, surgeries, and genomic testing is not standard for every patient every time they progress with the disease. We have restrictive treatment lines, and we cannot go back on treatments if we progress. And we all need all the drugs to be available to use them effectively within a toolbox of drugs. We need better access to clinical trials and an easier way to access them. MetUp are creating a database that make sure that all trials for breast cancer are collected into one document, because there is a problem with this and not having visibility of all the clinical trials on each database. Clinical trials have many restrictions to access, and we have limited access to trials due to the amount of chemotherapy patients already have had. If they've had numerous chemotherapies, it sometimes makes us ineligible for trials or trial access. I've campaigned for over 8 years about the lack of data. It was mandatory around about 15 years ago. Now an NHS audit has been agreed, but this won't provide data until 2023. Tenders will not be agreed until after October 2022, and then they have to start collecting the data. We have a 2 to 3 median life expectancy, which means some patients won't even be alive to see these results. If no data is collected, we have a lack of support due to no access to funds, not enough clinical nurse specialists, no services to support patients. How do we know what drugs are needed? How do we support secondary breast cancer patients with clinical trials? We need more services like radiotherapy and surgeries. We need more investment to survive longer. If we don't count patients, how do we know if survival is improving? We need to measure outcomes as there are no measures. We've watched a pandemic unfold and all the figures and statistics that were produced. COVID patients who are living with COVID are counted, and we know how many die from COVID, but we still don't know how many are living with secondary breast cancer. We just know that 31 die every day, 1,000 a month, 11,500 every year. We demand change. Thank you.